make a good peel that was progressive. So you didn't get anybody in trouble. So back in the old days, we used to have like 45% TCA, trichloroacetic acid peels, and they got bad burns. And some people got like keloids. So remember our friend Obagi, who developed the peel, and in about 1990, 91, 92, 93, the implants, silicone implants came off the market, and these plastic surgeons were looking for something to do, so they went into skincare, and Obagi says, come to my office and I'll teach you the Obagi peel. So he charged them each $10,000, so he had like 5 plastic surgeons in for the weekend, and he's a good marketeer. $50,000 it was worthwhile. So anyhow, he teaches them the TCA peel, 45%. So one of them, Jimmy Johnson, they're all plastic surgeons, one of them is from New Orleans. When he gets back home, he says, oh, I know how to do the peel now, to all his plastic surgery friends. I need a volunteer. So one of the plastic surgeon's wives, who's a pediatrician, volunteered, and he did the peel. The problem is that you have to precondition the skin ahead of time. You got to know how to do the peel, but more important, you got to know what to do afterwards. So they do this peel, and it gets really crusty, and instead of the peel coming off in like 5-6 days, it's still peeling at day 14, and she gets an infection. And she ended up with a keloid that goes all the way around from here to here. It took me a year to improve the keloid with positive pressure dressing and hydrocortisone injections. So it's preconditioning, knowing the peel, and then watching them afterwards, because all kinds of things can happen. They can get, like if they have a cold sore, like a fever blister, you can activate the fever blister, and you activate it in the middle of a peel, it can go all over the face and be a real problem. So you got to beware of the pitfalls. So if they have like a history of herpes every month, or herpes, I'll not peel around the mouth. At the same time I do the face peel. So I'll do the peel, leave the mouth alone, and then if I need to, I'll go back a couple of weeks later and do around the mouth. Because if you have new skin out here that's healed, it won't jump all over. So this particular PowerPoint doesn't have a picture of some of the herpes that jumped all over. But I was doing the progressive peel and in our office, and then my wife is there, of course, and one of our assistants is there, and after I leave, they decided to have a peel party. So they peeled each other, and they used a really strong many coats, and the assistant got the herpes flare-up that went all over. And we have her pictures, but no fun. So you got to be careful about the history for that. But let's move on with the presentation. So the idea was to have a peel that really worked good, but it was progressive. So you start out with the ProPeel number 1. Let me go back to that. I think it's the other way around. Yeah, here we go. ProPeel number 1 is, again, like I mentioned, the Yesner solution. Max Yesner developed this peel in New York, which was the salicylic acid, the lactic acid, and the resorcinol. Again, I mentioned we took the resorcinol out and replaced that with citric acid. That's called the modified Yesner peel. So we start with that, and you can cleanse the skin or condition with the toner, but I don't. I just go right in and use this as my conditioner and my toner, and use this as the first step in the peel. And then you watch the skin, because if they blanch out on number 1, you got to be careful and skip number 3. So I had one patient in the middle of a demonstration like this, was a model from, he was the brother of one of our estheticians, and little white spots showed up on his face with ProPeel number 1, and it turned out that he was a picker. And the spots had healed, but where he had picked, the skin was still healing underneath. So he got blanching. I call it the butterfly sign. So if you do like this and the picking, you end up with the 2 wings of the butterfly that blanch out, and you know you're dealing with a picker. So then I had to be very careful with the peel and not progress on to number 3. So that's the advantage of this slow progressive peel, is you go step by step by step and you can watch the skin. So step one, you may get some blanching around, especially like comedones, that where the surface of the skin is disorganized. You might get blanching, but it's not really that blanched. But then you go to propeel number 2, which is 7.5% TCA. And again, the idea is to go slow but put on multiple coats. So instead of one coat, we put 3 coats on. And it's interesting when you watch me do it, everybody's definition of a coat's different, because it's not just one little thing like this. It's like, so that's me, one layer. So,
and me too, because I learned from you.
I thought I was pretty aggressive, you know. I was, 1, 2, 3, and then I'm really aggressive. Everybody's different, and you got to get onto your own technique, because you want it to blanch, so you don't want to be too gentle, but you don't want to be a Cherokee Indian either. So this is propeel 1. Propeel 2 is 7.5% with salicylic acid, and then this is the 15%. And then we end up with the vitamin A at the end, which makes it really uniform peel. So then we have also extra strength, which is going from like 7% to 15% and 15 to 20% TCA. And in the extra strength, we also put in like a drop of phenol, like we put like 1% phenol, because esthetician can use phenol up to 3%. So we put a little phenol on there to boost it up even more. So today we'll look at the regular and the extra strength. Now I wasn't too convinced that the 10% vitamin A propionate in the number 4 was really important. So I did some half-phase studies. I did 1, 2, 3 on one side and 1, 2, 3, 4 on the other. And everybody came back and said the number 4 gives me a better peel. So they get more uniform peel when we add number 4. So after that experience, I became convinced that the vitamin A part is like important. So the objective is to improve the complexion. We use actually the peel on the acne. We do it on the melasma, and we do it on skin rejuvenation. We do it on everything. And it really is a booster. Helps. They got to be on their products first, and then they get the peel later on. So it works for the acne scarring. We combine the peel with like the laser for the acne scarring, the fine lines, and the hyperpigmentation. But you got to be careful if they're blotchy brown because of acne and they got reactive hyperpigmentation, will really help. If they're hyperpigmented because they have melasma, you have to be real conservative, because sometimes with melasma, 3 or 4 weeks after you've done it, you get a little skin inflammation, they get dark again. So we want to move ahead, and you need to know which acid to use and also the skin types. So when you look at the acids, this is that first one, the glycolic we were talking about, which is 2 carbons with the acid. Lactic is 3 carbons. Pyruvic is a cousin of lactic. They are both 3 carbons. Citric is 6 carbons. So citric by itself is too many carbons. So it's like too slow to go through the skin. So citric acid is not good by itself. We'll use it as a booster, but it doesn't work by itself. Our favorite again is the mandelic, because of the phenol and the antibacterial properties, and also it's bigger than like glycolic, so it goes through the skin slower, and we don't even have to neutralize it. So I won't neutralize the mandelic, although I'll watch the skin. If it really blanches out, then I will neutralize it. So these are all alpha hydroxy acids. The salicylic is a beta hydroxy acid, which means that you have the acid and then you have the first carbon, which is the alpha carbon, with the hydroxyl, with the glycolic. Then the next carbon down is called the beta carbon, and the hydroxyl on it makes the salicylic. So it's the beta. By itself, I'm not too impressed with salicylic. When I was doing studies with Dr. Kligman, we found out that vitamin A would peel the skin, but also peel the pore. Salicylic mostly peels the surface, doesn't peel the pores as well. So we use it as a booster, but it's not as good as the vitamin A acid. Then the fruity acids are just combinations, like the glycolic comes from sugarcane, the lactic comes from milk, and the citric comes from oranges. So sometimes they'll rename it just fruity acid, same thing. We talked about the vitamin A acid and how it peels. Resorcinol is a cousin of phenol, but again, some people get allergic to it. Phenol is a peeler by itself. The Yesner peel we talked about is a 3-part peel. The TCA, this is the Dr. Obaji's blue peel. So what he did was he added DNC blue number 4, I think, blue peel. He added the blue color, and it stains the skin blue. I don't like it because they're blue for 3 days till it peels off. With our peel, they may blanch, but then the blanch has gone away, and they just look like maybe a little bit red.
They look good. The same day they look like they have makeup on.
Yeah, a little rosy red, The blue, Dr. Obaji doesn't push the blue peel anymore. It didn't become that popular. Our Pro peel. And then there's the Only Touch peel, which is a strong peel just for the acne spots. And I don't like that because you don't know where the acne is going. You want to treat the whole skin. The brightening peel is putting in one of the brighteners like hydroquinone into the peel. And I don't believe in that too much because I want to do hydroquinone every day for like a month to precondition the skin. And to have it in the peel, you know, doesn't mean that much. Doesn't help that much. All right, so let me see if I can go ahead here. So looking at it, this is one of my early slides that shows the vitamin A or the fruit acid peels peeling the top, the TCA going a little bit deeper, and the phenol going deeper than that. So this is somewhat a myth because the skin's interesting. If you take the vitamin A or the fruit acid peel and you strip the stratum corneum, it sends a message down here below to really get going and make new cells. So we talk about a superficial peel, but the skin reacts as if it was a deep peel and makes new collagen, new elastic fibers, and really peels everything out. So we draw this, but it really is going to do the whole skin. We know what it's good for. This is our friend again, Sylvia, who had her skincare series of peels, ended up with Accutane, and we got her cleared up. This is Martha's favorite patient, Barbara Cunningham. So you guys met years ago doing skincare, right? Or hair? Hair.
She's a hairdresser.
Hairdresser. So she has the rejuvenation program. So she does the cleanser, the toner, the vitamin A every day, and then we add the peels to it. We've also taken our filler and filled this in and filled this in over here and the Botox over here. So she had a combination for skin rejuvenation, Botox, the Wink under eye lotion, and then their daily skincare. Interestingly enough, she had acne as a teenager, and the acne scars right here, the lines have lined up along the acne scars, and that's typical. I have a couple of old scars, and I'm getting lines right along the old scars, so that's typical. And then we put her on our program, and we puffed everything out and got her a lot better. The problem is if she stops the program, it'll go back. So we have to keep on her, keep after her, but she's a good patient. She comes in like every month, and we do a peel, and we do a little more filling. And so recently she was in for a little more Botox. So it's a maintenance program. She's on that all the time. We also use our Maxi Lip and our Maxi Lash to puff out. The Maxi Lip has in there 3 agents. It has in there the methyl nicotinate, which gives you the immediate little sensation of itching, but it pumps out oxygen. And then we have in there the perfluorodecalan, which generates oxygen. And then we have in there the peptides, which kick off new collagen. So we're able to get rid of the fine lines and with the Maxi Lip. And this is a girl with a melasma, and we got her melasma better. But melasma is tough. If we get too strong of a peel, it can get reactive hyperpigmentation like a month later. And if you look at Fatima, she's raising her hand. She's my test guinea pig, and every time we get a new peel or a new laser, we do it on her, and it peels off. It looks great, and then a month later, a damn melasma is back. So melasma is my toughest thing to treat. It's not easy. This is a girl here who had just sun damage. She's from Newport Beach, California, sun damage everywhere. So we did a series, she's on the program, we did a series of peels, and we got all of the sun damage spots off. So what I'll do is I'll do the regular peel, and then I'll take my Q-tip, and with number 3 and touch each one of these dark spots. And after it peels off, if she comes back with these keratoses, I'll just immediately, after it peels off, like 10 days later, I'll take my Q-tip and go back on all of the little sun-damaged spots and get them to peel off. She was an airline stewardess for TWA and got a lot of sun damage from sun exposure. This is the first patient that we put on the Mandelic after I went to Minnesota. I was teaching in Minnesota, and one of the people in the audience happened to be a electrologist. So at the end of our 2-day teaching program, she says, "Come to my salon, I want to give you a Mandelic peel." I'd never heard of the Mandelic peel before, so I went there. She took the 45% Mandelic and put it on. My toes curled, it'll burn like hell. And then she came in after the burning went away and did a gommage. Well, gommage is like a French cleanser. That's like our cleansing milk. It's like an oily cleanser. She put the gommage on. It activated the Mandelic that was left and burned again. I had 2 burns. But I liked the Mandelic, so we started incorporating in our line. And this is our lady after we got the dark spots lifted. So the interesting thing about Mandelic, it has the antibacterial properties, but also lifts the pigment. I don't know exactly why it lightens the skin. I say lifts the pigment as if I knew what I was talking about. But the dark spots get it really improved. So in our lightning program, we'll do the Mandelic cleanser all the time and the Mandelic toner. So preconditioning is the key. So you never want to do a peel when they walk in the door, because you don't know them, and you don't know how they're going to react, and maybe they're a picker, maybe they have herpes every once in a while. So we get to know the patient. So we get them on a preconditioning program. I like to do it like for a month. And then we put them on the 5-step skincare program where we try to keep them out of the sun, no smoking, place them on the home care program. If they smoke, it's not going to work, because every time you take a puff of smoke, you inhale 40,000 free radicals, and it keeps the collagen going downhill. So remember, you lose 1% of collagen a year. If you're a smoker, you lose like 10%, or 5 to 10% of collagen every year. So the smokers have the smoker facies. We got to get them off the cigarettes. And then we do our peels, and then we might add the intense pulse light or the LED light at the end. So we want to really stimulate the wounding. So if you just wound the skin, it takes like 10 days for the skin to start really proliferating and to heal up the peel. But if you do your preconditioning, you move this proliferation down to day 1, so they heal much quicker. So you really want to precondition them to get the skin moving. You don't want to do a pro peel when they're actually physically peeling off big chunks, but when they've gone through the conditioning phase. Remember, if you start them on day 0, about day 8 or 9 or 10, they're really going to peel, and then they start to get used to it, like day 15 or day 20. So out here, about day 30, they have microscopic peeling, and they're going to get a good peel, but they don't have that chunky peel they have at day 8. So you want to get them over the chunky peel. And so I have a new word there, chunky peel. All right. So the free radicals, you got to stay away from those. No sun, no smoking, no sugar, and stay on that. This is just the free radicals from sugar, from the sun, from smoking. In LA or China, they got the air pollution and the white blood cells coming in. So we do the cleanser, the toner, the vitamin A conditioner, which we were talking about, and then they wear their day treatment lotion with the SPF. So how long do we precondition them? It depends on their skin type. So if they're blonde, blue-eyed, you probably don't even have to condition them, other than you want to get the cells moving. So we do it for like 4 weeks. The higher the skin type, the more pigment, the longer we precondition. We want to really get the cells lightened up. So on a really dark skin, I'll do more preconditioning, and also on dark skin, I often skip number 3 because I don't want to irritate the pigment. So here you got TCA peel. Here's our our full TCA peel, the progressive peel. Here I don't do number 3 because I'm too nervous to get reactive hyperpigmentation. So this is just showing our skin cells, and it takes 28 days for the cells to come up and fall off. When you precondition, you're going to get the cells to come off like in 14 days. The skin's really jazzed up, and it'll heal much quicker. So we talked about the modified Yesner, the TCA, and the vitamin A propionate. So there we go. So let's do the peel. So we do Pro Peel 1, 2, 3, 4, and oh wait a minute, maybe I'm going too quick here. So we also drink a lot of water. Dr. Yesner, who described the peel, would make them drink a glass of water between each peel. So they drink like 4 glasses of water. So you want them really hydrated because, and you also, it doesn't mention it here, but you also want to be careful how much area you do because there's a rule of 9s. You have 9% of your total surface is on the face, 9% is on the chest, and 9% is on the arm. So the 27% is the max you can do with the peel at one time because it contains salicylic acid. And if you do too much, you get too much salicylic acid in, their ears ring. So they'll call you at 2 o'clock in the morning and say, oh, my ears are ringing and I'm nauseated and I'm vomiting. So you want to really hydrate them to get all that salicylic acid out. Drink a lot of water. And you want to have your eye rinse solution in case you happen to get anything in the eyes. We use 3x3 gauze, and then you want to make sure you wear your gloves. All right. So here I am doing actually this is not me, this is Olga. The reason I know Olga is because she's a small Colombian, and when we're doing our demos, we only have large gloves. So there's Olga trying to do a Pro Peel with large gloves. But we start in the hairline because if it runs, we want it to run back into the hair and not into the eyes. So always be careful to start in the hairline. So I'll emphasize that again, start in the hairline. And when I'm watching people do the peel, they forget and they start on the brow line. And that's risky because your sponge is wet and you're doing the brow, it runs right into the eye and causes a problem. So I start on the hairline with her head back, so if it runs, it'll run back. I go all the way around, and then I do like concentric circles closer to the middle. So by the time I get close to the eyes, my sponge is dry. And then I can do like the lower lid and the outer third of the upper lid. The outer third of the upper lid is really like the same as our cheek skin. So I'll do the outer third and the lower lid with the peels. But always start into the hairline and the jawline. And if I'm going to do the décolleté, I'll start, you know, on the next to the nipples and work my way up, and maybe start in the hairline, go around, make a big circle, and come in closer and closer. Not too much around the neck, because people move, and that's on the collarbone here is real sensitive. So I'll take a conservative approach right along the collarbones. Now sometimes I'll use bottle number 1 to cleanse the skin. Like I mentioned, you can use the toner, or you have them clean their skin with the green tea ahead of time. But one of the interesting side notes here is working with the mineral makeup. The mineral makeup like what's the name of our mineral makeup we like? Jane Arendale. Jane Arendale. If they're using like mineral makeup, it's interesting. I do a coat, and even though I have them cleansed, they still have color coming off. So actually the mineral makeup sinks into the stratum corneum and takes me like 6 or 7 coats to get it off, which is a good sign because when that pigment gets into the skin, it's like a sunscreen and helps protect against the sun. And then we're moving to Pro Peel 2 and 3, and we're looking for the frost on the skin. So that you'll see first the pores that have acne in them will frost first. And one of the areas that's resistant to the peel is right here by the ear. So Olga, you can see Olga's still working here. Olga will take the Q-tip and do extra coats right around the ear here to make a uniform peel. So she's starting to get red and a little blanched, but in the middle here it's not working. So we'll do a booster right here because I don't know why this skin is resistant to a peel, but it takes more. And then they hold the fan. So I don't know if we have fans in. We do. So they control the peel because they hold the fan. So you don't want your assistant to hold the fan, you want them to hold the fan. Because you tell them, between 1 and 10, how much does it burn? Well, with Pro Peel 1, maybe 2. And then Pro Peel 3, maybe 4. Propel 3, oh, 8. And the fan, you'll see the fan come up close. So when the fan's up close, you can't do any more peel. You got to wait till it cools off. And when the fan goes back, then you can do your next coat. So they'll have the fan right up here to cool it off. And you have to just let them cool it off before you put on another coat. So they control the fan and they control really what's going on. So they hold the fan. The closer the fan's holding the fan, the more fan they'll feel, but also the less burning. And then we do the Propel number 4, and we call it blend, blend, blend. So you'll see we'll use the Woods light, and since vitamin A is fluorescent, you can see any skip areas. And we'll show you that today. So I've got to make sure I have the Woods light, Fatima. So for that, I have the clinic Woods light in the car. It's a little stronger than ours, but. And then posting directions. You want to leave it on. So you leave it on until at night, and then you can shower it off. Now the really aggressive estheticians, I have one in Orlando, really gets a big peel. So she has them leave it on 3 days.
Wow.
And then wash it off. I don't know how she talks people into leaving it 3 days. But anyhow, they get a good peel. The longer it stays on, the better the peel they get. So the least you want to do is wash it off that night, and they can leave it on at least until the next morning. The trouble is that the yellow color of the vitamin A may stain their sheets. But the longer it stays on, the happier we are. So we blend in number 4, not to wash the area for about 5 hours, and let them sleep with it and wash it off in the morning. Or if you're from Orlando, 3 days later. Olga's still working. Our gloves are getting bigger and bigger.
You're falling off. I can't believe it.
All right. So they go home, do nothing, and they shower it off with the green tea, and we give them a post-care kit. So the post-care kit has in there the green tea cleanser, the recovery ointment, which is petrolatum and mineral oil, plus aloe vera, the 200X aloe vera. Helps it clean, helps it really heal quick. And then if they have melasma, I'll start the bleaching program. I start at day 8 or 9. So they bleach right away to try to avoid the hyperpigmentation. And then gradually in a couple of weeks to get back onto their skincare program. Now when it starts to peel off, it comes off in chunks. And what we want to do is avoid the picker because they'll rip it off. And here it's ready to come off. It always starts around the mouth. That's the area of most rapid healing. And it'll start to peel. And I don't want them to pull it off. So what I'll do is I'll tell them, well, if it's loose, you can gently lift it up and take a pair of cuticle scissors and cut it off. But don't rip it off because out here it's not ready yet. And you'll end up with reactive hyperpigmentation out there. So don't let them pick it off. The trouble is with pickers, they're uncontrollable. So I'll have a picker, I'll give her a lecture, she stops picking, I do a pro peel and she starts picking again. So they can cut off and then they're going to use their home care kit. This is just a patient showing you the blotchy brown. And when you first do your first pro peel, you're going to dump pigment. So all the reserve pigment in there is going to come up and peel off. So they get darker right away. I mean, they can get dark, when you get done with the peel, they're darker. And then the next day they're darker, and then it peels off. So that's normal. So tell them if they're blotchy brown, they're going to get more blotchy until they peel off. So it begins around the mouth, always around the mouth, and then it moves out. So this is day 2, day 3, day 4, day 5. So I like to do the peel on Thursday because Friday they look just like dry, like a snake getting ready to peel off. Saturday and Sunday they peel around the mouth, and then Monday it's like out here, and then Tuesday it's like at the hairline. So the best is like on a Thursday. You see how she turned dark. So here now, this is later on, day 4, and she's peeling right here. And often I'll bring them in for a treatment with the Prozyme, because the Prozyme contains papain, which will dissolve off dead skin cells and takes this off. I got a picture of that. You can see after it all comes off, the pigment is gone. And I'm not sure it shows it here. Yeah, it does. So you've got day 2, day 4, day 6, day 8, and then day 9, day 10, day 12, day 14. Like take It takes maybe 2 weeks for the back of the hand to peel off. So they'll come in, they'll say, oh, Dr. Fulton, my face peeled great, but look at my hands, did nothing. And you say, wait, because it's going to peel off like in 14 days. It takes a while. The further away from the heart, the slower the proliferation, the longer it takes. So here we are on day 8 on the neck and day 10 on the décolleté. So it just takes longer away from the center part of the mouth. So this is when they come in, we'll do a Prozyme treatment, like on Tuesday or Monday, to take off the dead skin cells. And this is one of our patients who are peeling off here. We put the Prozyme on, and she still had some left over after Prozyme 1, so I do a second coat on there, and then I peel it all off. So this is just showing you the progression across the face. So this is like the next day. This is a heavy peel on a light-skinned patient, so we could do extra coats. And here she's starting to peel around the mouth, and then it moves out, and here it's all done. So this is like day 2, day 4, day 6, day 8, and then she's done. And this is an Asian lady from Korea with the melasma, and this showing the progression of the peel across the face. Right afterwards, she turns dark, dumps the pigment, and then it starts to peel off, and here she's all lightened up. The trouble is, she comes back 3 weeks later, and the damn melasma's back. And she can speak English, but when she comes back here at 3 weeks and it's dark, oh, she only spoke Korean. Cha cha cha, cha cha cha, she's eating me up, man. All right, so this is another case of acne, and she looks like a picker, so you gotta be really careful with the pickers. This is an older lady who had a series of peels, and we're starting to get her rejuvenation. Now again, she's on the rejuvenation kit. She has a series of peels, and we got a whole lot better. Nowadays, we have the radio frequency treatments, and we're doing the radio frequency to tighten up the collagen underneath and lift up this nasolabial fold. So the reason for the fold is not the fold, but it's the fat and the skin falling down the fold. So if you use the radio frequency and tighten all this up, you get that improved. So radio frequency is something you can put in your office,
I use it now.
and really helps. What unit do you have?
I use from it's from here, from Miami.
All right. There's the Viora, there's a tripolar, everybody's got one. You have the Cavitron?
Huh?
Cavitron from Miami here? Something called the Cavitron. All right. So, so it's something you can add to the office, because radio frequency, it doesn't require a license. Anybody can do it. This is blotchy brown sun-damaged skin. So here's what I do. I do the Pro Peel. I take my Q-tip, extra number 3 on each one of those spots, and then when she comes back and she's peeled off and still got a few spots left, I'll touch with the Q-tip and do a couple more coats with that. This is the German girl who walks in the Alps every summer, and we put a little Botox in here, do a little filler in the lip. We did a little permanent makeup. We did a little eyelash, or eyebrow tattooing, and got her better. So again, it's a series of treatments, and takes about a year. This is just showing the peel coming across the face like a wave and making her better. Now, I got to be careful, because in dark skin, you're going to get reactive hyperpigmentation. So she has to start using the bleach right away to try to block that. And this is actually one of Dr. Obaji's pictures, and shows the blotchy brown spots. And after his blue peel, you know, all that's off. So, so we want to do the microdermabrasions and also the lights. Let's go back. I'm going the wrong way. Let's see if I can go back. Yeah, so professional treatments, use the microdermabrasions, or you can, this is the big Woods light. This is the red one for generating collagen. This is the blue one for acne. But actually now there's ones that has all different lights in it. The yellow, the blue, and the clear, which is the infrared. So there's complications. Every time you do this, you got complications. Acne can flare up. You can get hyperpigmentation. You get persistent erythema. You get a herpes flare up. We don't see hyper and hypopigmentation because we're not going that deep. But here you can see the acne flare up, especially around the chin. All those old cysts that are sitting there waiting to come out the third week of the menstrual cycle, they all get activated up. So I like to get them really clear and get that skin in good shape before I do the peel. Here is reactive hyperpigmentation. This is the mistake I made. I didn't go to the hairline. If I would have gone to the hairline, she wouldn't have seen it. So always make sure you go, especially in a darker skin, all the way into the hairline. So if they do get dark, there's no line of demarcation and everything will blend in. And if you get it nice and uniform, they don't even see it. Here's persistent erythema. I didn't realize this girl, who is a good friend of ours in California, Dana Scher, we did her peel. She had a baby, and she was carrying the baby around, and the baby ripped the bra line, the bra strap, and she got a bad burn from the bra strap from the peel. This is the herpes flaring up, and so if they have a history of herpes, you want to make sure they're on their anti-herpes medication, and you can do the pro-peel, or you want to make sure you don't peel around the mouth until maybe 2 or 3 weeks later. You can do the mouth by itself. But they can flare up, so I make sure these people who have a history of herpes have their antiviral medicine. And it's best that they start taking it the same day you do your peel, and they take it for like 5 days after the peel to avoid the flare-up of the herpes. Now, unusual reactions can occur. We did a pro-peel, looked good, but look at, she blistered. So sometimes you get separation of the dermis and epidermis from a good hard peel, so they get a blister. Here she sees she's dumping her pigment, and she blistered right here. So here's the blister. I just stick a sterile needle in and open up the end of the blister and drain the fluid out and let it heal. You don't want to take the blister off because that's going to be raw skin. And the best membrane to protect the skin is their own skin. So you just stick a little needle in, drain the fluid out, and then it'll heal up, and she looks great. No really problem. But beware of if you do blister, just drain the fluid out. All right, so here we go. This is the extra strength pro-peel for very oily skin. If somebody comes in and says, I didn't peel, and you did a good peel, and you think they're honest, then I'll do the extra strength next time. Light skin types, I can be more aggressive, or those with severe acne, sun damage, or mild melasma, I wouldn't do it. We should take that one off. Remove that one. Extra strength is the 10% and the 20% with a little bit of phenol added to it. So you want to learn how to do the pro-peel, do it every month. And I designed for them a year program. They go on their skincare program. They come in for microdermabrasion. They do a pro-peel. Maybe they do a radio frequency. They're on like a year program. And we combine it with our skincare professional treatments and add the pro-peel. So here we go. We're all done.
Great.
All right.